Good evening and thanks for staying tuned. Welcome to our COVID-19 special studios here on Channels Television. My name is Ladi Akiri Duluali. We bid you a most warm welcome. And here are some of the highlights at this hour on this pandemic. Hectic times ahead for domestic passengers and travel as more airlines suspend operations. Governors of Ekiti, Edo, Niger, and Nasarawa states on self-isolation over COVID-19. And 683 people die in Italy in 24 hours over COVID-19. "46 is the current number of confirmed cases of COVID-19 in Nigeria. Lagos now has 30 cases, while Osun State recorded its first case earlier on today. The Nigeria Center for Disease Control says both cases are those of travelers who returned to Nigeria in the last 7 days. At the moment, the Federal Capital Territory has 8 cases, Ogun 3, while Ekiti, Oyo, Edo, Bauchi, and Osun each have 1 case. Of the total of 46 cases, 43 are described by the NCDC as active, 2 cases have been discharged, and 1 death has been recorded. 4 domestic airlines in the country have suspended their operations in the wake of the COVID-19 pandemic as the lack of foreign passenger traffic is impacting negatively on domestic travel numbers. This comes on the heels of the closure of the 5 international airports in the country. Our aviation correspondent, Bukola Joe Oketumbi, reports.
Empty counters dot the landscape of the checking-in area of the international wing of the Nnamdi Azikiwe Airport in Abuja. The airport is one of the 5 international terminals short to foreign traffic in a bid to curb the spread of COVID-19 in Nigeria.
Turkish Airlines was the last international airline that departed out of Abuja with 180 passengers plus 3, with his crew. And we thank God everything was successful. We shut down the international, and all attention now is at the domestic airport.
Here in Lagos, the commercial capital, the story is not different as shops, little businesses and airline counters are closed at the Muritala Mohammed International Airport. For now, it appears this closure is impacting on the domestic airline sector.
The local airlines are already struggling, and because they don't have the feed from the international carriers that bring in international passengers that we distribute around. And local travel has also reduced. Past a couple of weeks ago, we have seen a decline, a steady decline of passenger traffic to close to about 40, sometimes 50%.
Meanwhile, Dana Airline has announced that it will have its last flight tonight. Aero contractors will suspend operations on Thursday, March the 26th, while Arik Air and Air Peace will close temporarily midnight of Friday, March the 27th, 2020. Bukola Joe Kitumbi, Channels Television News.
Of course, if you've been following the news closely, you would know that President Muhammadu Buhari tested negative to COVID-19. But what seems to be fresh is that his status is a thing of joy to the presidency. The president's special advisor on media and publicity, Mr. Femi Adesina, in an interview at the State House, says everyone is happy about that development. But our correspondent at the State House, Ibrahim Adra, now joins us live from our studios in Abuja with updates from the villa. Ibrahim, good evening.
Good evening, Ladi.
So, bring us up to speed. What is happening at the villa? What has happened during the course of this day?
Well, as you would imagine, the villa is also experiencing some sort of lockdown, if you will. the president media aide, when he spoke earlier on in the day, said it wasn't a complete lockdown per se. It would be a partial closure, and he would be right in the sense that there are some staff who are still doing their work in their offices. As you may imagine, the live wire of the villa at all times would be the visitors that come in, whether they are ministers or heads of government agencies and parastatals, or even visitors who are visiting the presidency. Without them, yes, there is a huge lull in the presidency. Everyone basically is doing his work from his offices. When we spoke with the president's aide earlier on in the day, he also mentioned the reduction in the number of journalists who cover the presidential villa from about 108 to just about 14. That too has taken a chunk of the population out of the villa, giving it that very quiet look that you would see. Suffice it to say, what arrangements on ground are pretty impressive, if you ask me, starting from the first gate, the pilot gate, up to several other gates. There are strict compliance with hand sanitizing, temperature taking readings and the rest, just to ensure whoever goes in there pass a clean health bill.
Now, I just want to also ask you to take a look at the way the president has been acting in the last couple of days. Can you tell us anything about his activities in the last couple of days?
Well, the president's wing, if you're familiar with the presidential villa, is pretty much removed from where journalists are allowed to stay. Unless you have business to do in that section, unless you're specifically invited to go there, you may not be able to access to say whether he's in the office or not. But then there are signs, there are movement, there are security presence and movement that if you are a regular in the villa, you'd be able to hazard a guess and say, yes, he is. Once that is on ground, we can fairly imagine that the president is in his office doing his work just like other members of staff are.
Ibrahim, let me also, as you mentioned, if you can't get into where the president is, you probably cannot talk too much about what he has been up to. But in terms of other activities happening, we've recently had daily briefings from ministers, from the presidential committee and so on. But that seems to somewhat have dried up. Do you have any information as to why that is the case?
Fortunately, no, at this moment. That's a little bit curious because the thinking is that that briefing would continue so the Nigerians are abreast of what development is going on. But not much is happening. Recall that yesterday the presidential task team was at the presidential villa. It went upstairs, I imagine, to the office of the chief of staff to the president, spent a few minutes and then came down, and their way out we asked specific questions. I did pose a question to the Minister of Information and Culture, Mr. Alai Mohammed, regarding, in concrete terms, the status of the Chief of Staff to the President as far as COVID-19 is concerned, and even that of the President. I didn't get any answer from that, and none of the aide is willing to speak in categorical terms regarding that. Suffice it to say, earlier in the day, Mr. Additioner did alluded to the President taking a test, and that test is negative. So why that briefing stopped, I wouldn't know. As you would know, that task force is headed by the Secretary to the Government of the Federation, whose office is not within the presidential villa.
Now, is there any indication of what we might expect to either hear or see in the next couple of days, possibly in the next 24 hours, from the presidential villa?
Well, we would just have to put our fingers crossed and see if anything develops. Like I did mention earlier on, work has been scaled down tremendously, reduced to perhaps paperwork in the various offices. So if anything big is happening, we would have to wait for that kind of information and wait to see what it is that would unfold.
All right, then. Thank you so much, Ibrahim. Ibrahim Adra is, of course, our State House correspondent and has been joining us from our Abuja studios. Thank you very much, Ibrahim. We'll get back to you if we have more or if you have more to give us. We also have an update from Bauchi State where Governor Bala Mohammed has tested positive to the coronavirus. You already know that. But one of those who came into contact with the Bauchi State governor is his counterpart in Edo State, Godwin Obaseki, who has decided to embark on self-isolation as a precaution. A statement by the governor's aide on media and communication strategy, Cruzo Osage, says the governor has sent his samples in for testing. The statement also revealed that the Edo State Index case is the Speaker of the State House of Assembly who is recovering following treatment at the Irua Specialist Hospital. The Ekiti State Governor, Kayode Fayemi, has also decided to embark on self-isolation. The governor, on his part, explained that he recently had a meeting with 2 other persons who have since tested positive to the virus. Just like his counterpart in Ekiti, the Nasarawa State Governor, Abdullahi Sule, has also gone into self-isolation after coming into contact with some persons who have tested positive for the COVID-19 virus, including the Chief of Staff to the President, Abba Kyari. Self-isolation after suspicions of having had contact with some confirmed cases of COVID-19 is what has made many of these governors do so, including Governor Abubakar Bello of Niger State, who has also gone into self-isolation. A statement from the governor's spokesperson specifically refers to his presence at the Nigeria Governors Forum meeting on March the 18th, which also had the Bauchi State Governor in attendance. Chinese billionaire Jack Ma is doing everything possible Chinese billionaire Jack Ma is doing everything possible to help Nigeria and indeed Africa overcome the COVID-19 pandemic. The prevention materials donated by Mr. Ma arrived in Nigeria earlier today. Nigeria also took possession of test kits and personal protective equipment, which contain 100,000 masks as well as personal protective equipment. The Permanent Secretary of the Ministry of Health says there are 20,000 test kits to be distributed to laboratories in the country. According to the Permanent Secretary, these test kits will be distributed in the course of the coming days. And as we did tell you yesterday, all this talk about self-isolation means that you, our guests, and those who are watching us at home also need to be fully aware of what it means to be in self-isolation, what to do in 14 days. And here we go once again. Self-isolation, of course, is purposely staying at home, away from everybody for a period of 14 days. Do not go closer than 2 meters, which is 5 feet, to anyone during this period. Stay in a well-ventilated room alone. Keep away from everyone, including family and pets. Do not use commonly shared household items. Ensure you work from home. If you have to work, do so during this self-isolation period. Ensure you have adequate supplies of food, water, toiletries, medications for existing ailments, and other necessities. Practice clean hygiene regularly. Cover your nose and mouth with tissue or elbows when coughing or sneezing, and immediately dispose used tissue in a covered bin. Wash your hands with soap and water. If not available, use an alcohol-based hand sanitizer. Clean and disinfect frequently touched surfaces such as door handles, furniture, and others using household disinfectants. Contact the NCDC if you feel feverish, keep coughing, have a sore throat, or difficulty breathing for immediate help. The numbers are there on the screen, and the other media handles are also there. At this point, we're being joined to take a closer look at the more recent developments by Dr. Doyin Ogunyemi, who is a consultant public health physician. Dr. Ogunyemi, thank you so much for being with us. Welcome.
Thank you. Thank you for having me.
Now, let me begin by taking the most recent developments, this going into self-isolation by quite a number of high-profile people, even though some of them are actually not showing symptoms. Are these good examples of what the general public should be doing at this time if they're in similar situations?
It's certainly a good example. The timing even for self-isolation is important. So if you've come from a country where there are so many cases already, you do not need to have symptoms to begin to self-isolate. It means that you already feel that you're at risk and you can be at risk to others. So that's the first reason why you should self-isolate. If you then, for these cases that have self-isolated, they're doing so because somebody they had contact with has come down with the disease, which of course is positive. So we should role model self-isolation. But beyond that, we should role model things like social distancing, and that should be seen across board.
Now, it's good you mentioned the social distancing issue, because some of those that we have talked to point out that this is a somewhat difficult thing to adjust to in such a short period, because culturally, Nigerians and indeed humans are more, touchy relationships, social animals, if you like. But how quickly do you think we have adapted to this, given the fact that it has now become critical for us to do this in order to be able to combat this virus?
So I don't think we have quickly adapted to it, but we're gradually beginning to adapt to it. While it is nice to want to, we've seen that a lot of people are bold enough to say, no, we shouldn't be shaking at this time. And people are laughing over it, and that's what it should be. We're giving up some comfort for a better gain later. And so social distancing is even practiced now in some banks, in some supermarkets. They're, literally putting circles where people should stand. And that should be the way. We should encourage it. This is not the time to stand next to each other, taking pictures just for, putting out some statements. We really just must do the business of what social distancing is about.
Now, do you think that we are now focusing on the infections or the spread of infections that are in country, and because now virtually all our borders are shut, we don't really have to worry about more spreads from outside the country, as it were?
I think we already have a lot of cases that may have been imported. Remember, the incubation period is 14 days. So, it's not time to sigh and say we've closed the borders. We probably are waiting for another 3 to 4 weeks to actually say what will happen, having closed the border on this day in terms of imported cases. But then we've moved beyond imported cases to local transmission. So people that are around imported cases who were not isolated are beginning to get it. And a bit of community transmission where we cannot say that this person actually got it from this other person. When we lose that tracking, then there's a bit of community transmission. And I think there's a bit of that already. So it's good. We've started from what was really difficult to do. We've closed that border. But now we're in, and the cases are all mixed up together. What do we need to do? We need to spread apart to allow time for the viruses to become inactive in our midst, and then we'll then be able to relax a little more. But we need to do a lot more now.
I want you to, while we're going to take a break in a couple of seconds, but while we're on break, I want you to think about the welfare of those who are on the front line of all of this, the medical personnel like yourself and others who are having to face some of these patients who will be coming in. And if, as you point out, as we take a look at some of this, as more and more of these time goes and we find out whether or not we have more and more cases, what needs to be done to protect? We talked about Jack Ma earlier on, his donation of kits and masks and so on having arrived the country. Where do these need to go, and how quickly do they need to get there? But that will be after this break, so please stay with us. Thanks for staying tuned. Welcome back to our COVID-19 special studios. We still have with us in the studios Dr. Doyin Ogunyemi, who is a consultant public health physician. And Dr. Ogunyemi, I know I did ask you to think about this before we took the break, so I'll give you an opportunity to answer. The kits that were being expected as part of the donation from the Chinese billionaire founder or co-founder of Alibaba, Mr. Jack Ma, have in fact arrived. Now, that brings to mind the question of those on the front line here. medical personnel like yourself, how quickly do these need to go out? And if so, where do they need to go immediately? And take that as a peg to answer the general question of how are we doing in ensuring that the medical personnel who are treating this are properly kitted?
So I know the NCDC has the Logistic Management Information System, which is like supposed to be a central place that monitors where kits are, where is needed, and ensure that it can get to such places at the fastest time. So this is not a matter of sharing kits based on the number of states, no. This is about where is it needed the most. And we know, for instance, some states like Lagos State has the highest case. So I would expect that, quite some chunk is in Lagos State. But then there should be a centralized place where we know what we have and it can get to where it is needed at the fastest possible time. Many states have not recorded any case, but the distance between when one state would have and another will have, it's nothing that we should begin to debate about. Any state can need at any time, and it should be sent at such times. As regards PPEs for health personnel, it is so important. And first and foremost, I would say that even when patients suspect that they may have the virus, when you visit the hospital or the nearest health center you're able to, it is best to be able to declare and say that this is what I think. So many hospitals already are doing a lot in terms of PPEs, but maybe not the entire outfit they need, but in terms of face masks, hand gloves. So when such people come and they're being suspected, they will be put in a holding area, some kind of place that the patient is the only one there, and they can make calls and ensure that the patient is well catered for in terms of specimen taking and all of that. So our health personnel are actually at the front burner because people that may have contracted the virus also have other diseases, and they may also have emergencies. Somebody can come in labor, but is also having, the COVID virus. So we should ensure that for private hospitals, these things are provided. For public hospitals, these things are always provided. These things should be there even before epidemics like this. But now we should step it up as much as possible. We expect more people beyond what the billionaire from another country has done. We expect more of that from corporate society and corporate organizations who can do the same and ensure that we have enough for health workers.
All right, Doc. We'll take a short break from our conversation. Don't go anywhere, because we're going to go first to Bauchi, where Hajara Aliyu has an update on the situation there. Of course, one of the most prominent people who has, in fact, tested positive to all this and who may have led several of his colleagues to go into self-isolation is the governor of Bauchi State, Bala Mohammed. And Hajara Aliyu is our correspondent in Bauchi. So, Hajara, bring us up to speed.
Here in Bauchi State, the government seems to be taking measures one step at a time to mitigate the spread of the coronavirus. The latest is the directive given for all markets to close, and this will take effect from Thursday, the 26th of March 2020. The announcement was made earlier by the Deputy Governor at a press conference.
His Excellency, the Executive Governor, Senator Bala Mohammed, has approved that from tomorrow, all markets all over the state will close, except for food items and pharmacies and medicine and drugstores. And this order will be followed strictly.
The police are expected to ensure compliance to this directive. And another area the government seemed concerned about is the transport sector.
His Excellency is also advising the leadership of the Road Transport Workers Union to sensitize their members to ensure that they only carry 4 people in a vehicle.
Government says it has identified a place where it could make purchase large quantities, but this is pending approval from the Nigeria Center for Disease Control. So far, there are 4 isolation centers that have been established across the state to manage any suspected or confirmed case of COVID-19. From Bauchi State, Hajara Aliyu.
And from Bauchi, in Abuja, the midweek briefing by the Presidential Task Force on COVID-19 by the Minister of Health in Abuja did not take place today. And there is no official statement from the government to explain why it failed to take place. The Minister of Health, Dr. Osagi Ehanire, had earlier this month promised to give regular updates about how the government is working to prevent further spread of coronavirus in Nigeria through press conferences on Mondays, Wednesdays, and Fridays, a promise he has kept in the last 3 weeks. Journalists, however, waited in vain on Wednesday, March the 25th, for the minister to call for a briefing or issue a press statement to update the citizens on the current state of things. 2 separate news conferences by the Presidential Task Force for the Control of Coronavirus in Nigeria were also suddenly cancelled yesterday after journalists had waited for several hours. It is believed that the Minister of Health and some other high-profile government officials cutting across different sectors who are part of the 12-man Presidential Task Force are self-isolating after being exposed to some persons who may have tested positive to coronavirus. And now we stay in Abuja, where we go to our correspondent, Kayla Megwa, who has been taking a look at the level of compliance with the restriction orders relating to gatherings and how people generally are taking to the enforcement of restriction of general movement. Kayla, good evening. So what's happening?
Good evening, Laddie. Okay, so there's a partial lockdown. That's what is being called right now. Partial lockdown on all activities in the nation's capital. Markets have been asked to close shops of people who are not providing essential services. So we went to Wuse Market today, which is one of the biggest markets in the nation's capital. And we found out that all the shops were closed. We were there yesterday and all the shops were open, which of course was a bit of a scary situation considering, you know, the fact that there has been a stay-at-home order in the nation's capital. However, today when we got there, we noted that traffic had reduced, and it's not just in the market. We're talking about in places like Garki, in places like Wuse, where they're known for heavy traffic. A lot of those places, the traffic has gone down drastically, which means that a lot of people are staying at home. Probably due to the fact that civil servants from grade 12 to 1 have been asked not to come to work. So a lot of people are at home. Many schools have been shut. All schools really have been shut down. So a lot of kids are at home. So there isn't a lot of traffic anymore in the nation's capital. At the markets, we did see people selling food, all right, so food stuff, provisions and things like that. Those stores are still open. I spoke to a man who sold wrappers today and who was very worried that because the shutdown is for 2 weeks, and he's saying he doesn't think that they will be reopened in 2 weeks. He's worried about how his business is going to fare after that. But there is a big problem, Laddie. One of the problems in the nation's capital is that many people are not adhering to the stay-at-home order. And I do have to say, this is something we noticed today even with the orders and with the advisories given by the FCT minister, we still have a lot of people going about their business as though nothing is going on, and that is a bigger problem. We also have questions of people who came into the nation's capital who have not self-isolated, and Mr. Lai Mohammed was talking about this not too long ago, talking about how they are looking for over 1,000 people who are related to the contacts who have tested positive to COVID-19, and they're trying to get those people to come in, get them to self-isolate, or get them tested. And a lot of them are not budging. No one is showing up. And he actually at the time said that they were thinking of using the military to cajole them to do the right thing. But in the nation's capital, business has gone down. I do have to say that. One worrisome sight we saw today was at the Area 1 complex. There's a shopping complex in Area 1, and all the shops were open. None of them were providing essential services, not a single pharmacy. We saw that. We actually went there, took our time to check and see if these were pharmacies or places that are selling food stuff or provisions. Satellite companies. We actually saw phone companies. We saw people selling footballs, salons, clothes, and a lot of them were still open even today, which means that maybe the reality of the situation hasn't hit a lot of people in the nation's capital, but hopefully it will. But the only problem and the hope is really that this defiance or this lack of reality check that is going on among many people people who live in the nation's capital will not come back to bite us if the disease starts to spread all over the place. God forbid. But people need to take the necessary precautions, self-isolate, stay at home if you're not providing essential services. And that is where we are in the nation's capital at the moment, Mr. Ladi. We will be checking up every day to see how the compliance level is going.
Thank you very much, Kayla. A comprehensive report from Kayla Megwa in the Federal Capital Territory. A bit worrisome there that compliance levels in some parts are low, as she was reporting. But there appears to be more being done by some other groups aside the efforts of the federal government in combating or curbing the spread of the COVID-19 disease in Nigeria. The African Center of Excellence for Genomics of Infectious Diseases, located in Ede, Osun State, a facility co-owned by a private university, the Redeemers University, is making efforts at discovering ways to tackle the deadly virus by researching into its nature. The center is an accredited NCDC testing center, which is helped with the sequencing of the first coronavirus, or the index case, which Nigeria was said to have had. And that was done under 48 hours, a situation which some experts say could not be achieved even in China and some parts of Europe. The center says it is making efforts in finding solutions to the disease and told Channels Television some of its discoveries on COVID-19.
We have been able to test samples that have been brought into the lab. So the sample of the index case, that is the guy from Italy, was also sent down here for confirmatory test and also for the genome sequence, whole genome sequence of that virus. So though it had been detected and confirmed positive in Lagos, but it was also sent down here to us here at SGD. And we also reconfirmed that it's also that the COVID-19 virus was present in that sample. And then aside of now confirming the presence of that, we now went ahead to do the whole genome sequencing of the COVID-19 virus to be able to characterize the virus. And the virus so far, as I speak, is presently in the public database, which I'm sure scientists are using to be able to identify diagnostic tool or detect a drug target, and also to be able to develop a vaccine. Well, as I speak, there is no licensed drug for COVID-19 virus infection. So what people are doing, or the clinicians are doing, is what they do, what they call like secondary or supportive treatment, managing the person for any other kind of infection or any other kind of complications that may come up along the line. And that's what they have done, which is not new for any viral infection. So it's not like there's a particular drug given to cure the virus, this particular virus, but what they have done is to give like a supportive treatment to make sure that they protect the individual from any other complications that may arise. In this particular case of COVID-19 virus detection, because it's a respiratory viral infection, so it affects just the respiratory part of human beings, so from the nose through the throat and then the lungs. Those are the affected parts, and those are the possible places you will see the virus.
And now time for our global update. The global death toll from the COVID-19 pandemic has now risen beyond 20,000, with the number of cases exceeding 451,000. This comes as the number of deaths in Spain, France, and Italy remain on the rise. France this evening reported 231 new deaths, bringing the total to 1,331, with the number of cases now at 25,233, including 2,827 people who are in a serious condition requiring life support. Spain's death toll surpassed China's, becoming the second highest in the world after Italy. The country saw its steepest daily spike in deaths, up by 738 in just 24 hours to a total of 3,434. Italy, on the other hand, reported another 683 deaths in the past 24 hours and 3,491 more cases, slightly lower than Tuesday's tally of 743 deaths, taking the total to over 7,500. In the Middle East, Palestine reported its first death in a 60-year-old woman. The country has reported 62 confirmed cases. Israel reported 5 deaths with 2,030 cases, while Saudi Arabia reported its second death and announced a 21-day nationwide curfew that started on Monday. Also, Dubai today reported 85 new cases. Here in Africa, Libya and Mali, both conflict-hit countries, have recorded their first cases of the virus, and Ethiopia is to release more than 4,000 prisoners to contain the spread of the coronavirus in jails. That being our global update for the moment, let's now go outside our shores and talk to Dr. Shemaine Emelife, who is president of the Association of Nigerian Physicians in the Americas. Good evening, Doc. Thank you for joining us.
Good evening. Thank you for having me.
Dr. Emelife, of course, is joining us from Atlanta, Georgia. Now, some of the news we're hearing out of the United States is a bit troubling. Can you update us on where we are with the COVID-19 pandemic in the U.S.?
It is indeed troubling. Right now in the U.S., the numbers changes by the hour. Right now we have about 64,115 cases in the United States, and we have recorded at least 838 deaths. And this numbers changes. So by the time I'm done talking to you now, and you look at the statistics, it's probably going to be quite different. In Georgia here, this morning, we were still quoting 1,097 cases with 38 deaths just in the Atlanta, Georgia area in the state. As at 2:28 p.m. This afternoon, it's already risen to 1,247 cases with 40 deaths total. So it keeps evolving, it keeps changing. There is a lot of cases in the United States, but there's a lot being done as well to flatten the curve, right? A lot's happening here. There is a lot of sheltering in place ordinance. People are basically just going to work. Essential workers like us, the physicians, go to work and come back home. Churches are no longer, out there having masses or having any, rallies or having functions going on. There are no. They're not having all those anymore. Schools are closed. The children are at home with their parents. Restaurants are shut down. So there's a lot being done. We would have more cases if there isn't a lot more happening here. So knock on wood, we are hoping that we will reverse this and things can get better. But it's a very, very sad situation, sad times right now.
Now, of course, I know that Nigerian physicians in the U.S. will be interested in what's going on back home. Just give us an idea of what you think of what we're making of the situation back here in Nigeria.
I would hate to be here in the U.S. and believe I know exactly what Nigerians are doing, but from what I hear, there's a lot about washing your hands, social distancing. I see a lot of videos. I have conversations with lots of our friends and colleagues, and they claim they're doing that. But when I see pictures where governors are still having parties or having celebrations and people are coming together and hanging on to their mask and singing happy birthday, and there's a lot of people in one room, it makes me wonder how much of social distancing that we're really observing there. Or when I see pictures showing me that we still have leaders having weddings for their children and all of that is still going on, it makes me wonder, are we really, really serious? Do we understand what social distancing really means? So again, I wouldn't stay here and imagine that I know for sure what's happening, but I would like to believe that the social distancing, the hand washing, let's not shake hands anymore, let's stay 3 feet away from people that we are proposing here, that's exactly what's happening.
Now, Europe is particularly hit. I mean, Italy and Spain, to take two prime examples. And some have related that to aging populations, which have helped to spike the death toll. Now, do you think, again, more should be or more is being done to ensure that that situation is curtailed and that the bans now being placed on travel would help stem that?
I definitely do think that the bar on travel will definitely help stem that. No question about that. There is a lot of cases being imported from outside. And in fact, I would tell you that one of the cases, actually our first case here in Georgia, was a returnee from Italy. So definitely the bars on traveling and closing the airports is definitely a good idea. Now, there is this situation about who is really susceptible to this a virus. We do know that the older people are said to be more susceptible. If you already have pre-existing illnesses, other illnesses like diabetes, some respiratory diseases, regularly baseline, you have COPD, stuff like that, diabetes, you already, this hits you harder when you get the infection. So the goal would be to prevent people from the exposure, right? And if that happens, so both the older and even the younger people, we have young people also infected and are going through serious situations with this virus. But to answer your question, definitely the bar on travel, the closing of borders, and sheltering in space in place is definitely a good way to curtail the spread.
Thank you very much, Dr. Shemaine Emelife, who is, of course, the president of the Association of Nigerian Physicians in the Americas. Thank you so much for joining us from Atlanta, Georgia.
Thank you.
Now we'll take a break. When we come back, we'll have our final moments. Of course, we still have Dr. Doyi Oguyemi with us in the studios. We'll have our final moments with her, and we'll bring the program to a close. But that will be after this break. Please stay with us. Before we take our final moments with Dr. Oguyemi in the studios, let's take an update from Ibadan in Oyo State, where Bukola Oriowo is standing by.
Here in Oyo State, just a few minutes ago, the governor ordered that all civil and public servants should begin to stay home from Friday the 27th of March. That's in 2 days' time. And they're going to stay away for the first 2 weeks, after which things will be reviewed and counter orders could be issued after that. Apart from that, the Jericho Chest Hospital, which is a designated main isolation center, has just been upgraded from a 5-bedded to a 10-bedded hospital to take care of any other cases that may arise. The only confirmed case is currently receiving treatment at that hospital, and according to the Commissioner for Health, everything that is needed has been provided. And apart from that, 2 other isolation centers are currently being set up, and all equipment that are needed are being sought to make sure that that place is well equipped and it's running. From Ibadan, the Oyo State capital, Bukola Oriowo.
Thank you very much, Buki. And Dr. Oguyemi is still with us, Dr. Doyi Oguyemi. Dr. Oguyemi, our final couple of minutes here in the studios. Let me ask you, now that we seem to have come to this stage, everybody is talking about restriction of movement and so on. Can you speak to, from a medical perspective, why this issue of restriction is very important for those who still seem to think that maybe we are overreacting?
So it's by no means trying to overreact. We're taking the step with restricting movement is to more or less emphasize the fact that the virus needs to be able to thrive by moving from one person to the other person. And the only way we can, break that transmission is to prevent that movement from person to person. So when we restrict movements and with less people gather, then that tendency is less. It can't stay for too long on in the air or on surfaces. So because of that, we're restricting movement as much as possible. When you stay at home, you are safest there. When you meet somebody, you do not know where the person has been. You cannot tell if the person is already infected because they do not need to show symptoms to be able to shed the virus. And that is the reason why we're saying, let us begin to stay away and let us stay at home. Let us protect even the health workers that are out there in the hospitals and other people that are doing essential services by staying at home and making sure the virus does not go
Thank you
around.
very much, Dr. Doyi Ogunyemi, for joining us on tonight's COVID-19 special. It's been a pleasure having you with us in the studios. Thank you so much for coming.
You're welcome. Thank you.
And that's where we're going to end tonight's show. Do join us tomorrow. We have 3 daily updates, one at noon, one at 6, and then, of course, the final one at 9, which is the one we're wrapping up now. My name is Ladi Akre Duluali. Thanks for joining us.